As healthcare gets more specialized, very few of us see just a single doctor. And as a consumer in healthcare, and involving multiple doctors, it can be challenging to get the doctor the information that they need from your other care providers. So your medical records are really important to keep track of because they're, even with electronic medical records, they're still not a master medical record for all of us. So today, CindiGatton, a patient advocate, tells us about a new tool that she found and to introduce a guest to us. Good morning, Cindy.
Good morning, Dr. Gallup.
So what have you found?
Well, I have found a tool that I have started using for my clients called CareSync. Your listeners may remember a story that I shared some months ago about a client I worked with by the name of Joanne.
Yes, right.
Who had multiple medical conditions and didn't feel like her doctors were really listening to her. So we requested her medical records. We built a timeline of her care and created a document that she could use as she was establishing with some new physicians. And the effect was really dramatic. She reported that not only did she feel like her physicians were hearing her and understanding what her needs were, but that the quality of her care really improved. But doing this is a really time-consuming process. When I discovered CareSync, what I've found is that it is a much more efficient way for me to help my clients gather this information, and it lets me focus with them on what we're going to do with the information, not on collecting and collating it. So this morning I asked if Courtney Larned, who is the VP for Marketing and Communications for CareSync, would join us and share a little bit about how their company was started and a little bit about their tool.
Well, excellent. Good morning, Courtney.
Good morning. Thank you for having me.
Well, thank you for joining us. Tell us about CareSync and how it began.
Okay, well, CareSync is a complete personal health system. We combine technology with human touch, as we like to say, and we actually go and get all of the user's medical records from all of their different providers. We take that information and we put it into our application, which is available on our website and Android and iPhone applications as well.
Oh, wow. So you have an app for the iPhone.
We
That's
do.
great.
We do. The apps are actually free to download and use if you had your own information already, because we really do want to encourage caregivers and family members to participate with the information that you're gathering as well. But we go and we get all the information and we transcribe the plan and assessment from each of past medical visit in the records into a really concise summary that the average person who doesn't have clinical training can access, understand, make it very meaningful to them, and then they can share it back with all of their providers.
Well, that's great. Yeah, I got to tell you, as a doctor, as a provider, I've not seen this technology yet. And so I'm excited that I can actually use my iPad, which we have plenty of in the office, and my iPhone to actually get medical records. As an ENT doc, we do see people that have multiple doctors. They tend to not be necessarily as ill. But this isn't just a product for people that have chronic illness, is it?
No, it's not. We actually are quite passionate that everybody is a patient in some way, and they should be responsible at some level for carrying around their health information. We have other features and functionalities built into the application as well. So we connect with Fitbit ARIA scale and Withings blood pressure devices and things like that. So we bring in a lot of the in-between visit data, as well as things like journal and pain scale, where patients and their caregivers can track.
Wow, now that's amazing.
The they see their doctor.
There are components of telemedicine. It sounds like, to be able to monitor, from afar in your home. Now that is an innovative healthcare technology. To do that and to provide an application. I think it's really interesting that in this day and age of electronic medical records, that all medical records aren't available. Because I'm going to tell you, I bet our listening public thinks, oh yeah, with all the expansion of electronic medical records, this paperless system, I don't care where I go in the world, they can get access to it. But you're telling me, Courtney, that obviously you can't.
No, I don't think. I mean, I know for a fact that this day and age, everyone is implementing these great technologies, but even the patient portals, they have low adoption, and even when they are adopted, you still only have the access that they choose to give you. So, and then they're siloed between health systems. I live in Baltimore, and I have records at University of Maryland and at Hopkins, and they both use the same system and the same portal, but they don't communicate with each other.
That's just unbelievable in this day and age that they won't do that. Because, I know we have a patient portal. Listen, the problem we have at the ENT Institute is getting patients to use the patient portal. We give them access and they don't use it. So, again, I think we're just evolving. Once again, we're talking to CindiGatton, patient advocate, and Courtney Larned from CareSync. So, CareSync has been evolving. Tell me how you got started and how have you evolved to this point?
Well, our team has worked together on other projects. But a few years back, our current Chief Operating Officer, Amy Gleason, her daughter was diagnosed with a rare autoimmune disease, and they started seeing many, many specialists for managing multiple medications every single day, and information was not effectively being passed from doctor to doctor in a timely fashion. The responsibility fell on Amy, and Amy, who has a clinical background and has been working in healthcare IT for most of her career, kind of had a moment where if I can't manage this, who can? So that kind of led to the process of, well, we need a service. There are a lot of tools. She tested everything under the sun, but it still ultimately requires the human touch, and that is our services team who goes and does the work of getting the records and putting it into the account.
So people go to your website and join, and then you lead them through the process about how to put their medical records on your system.
Yep, we're built using the same databases that electronic records use in hospitals and doctors' offices. So the information that gets entered into CareSync is easily shareable with those systems as well. So we have a doctor database of the United States. So you really just start putting in your doctor's name. He should come up in the list, and you add him. And it's as simple as clicking a button for request records. You digitally sign the HIPAA authorization form. And hit
all those things. You just make it happen, though, is the bottom line, right?
We do it.
Well, Cindy, let me ask you.
People don't do it on their own. It's hard, and it's stressful, and it's overwhelming, and it's time-consuming.
So, Cindy, you find that CareSync has really helped you provide great patient advocacy.
It really does, because if I were to do this individually, I have to get a written release form. I send it off to the institution or the doctor. We wait to get it back. And what CareSync does is they automate all that. Even some of my clients that are not particularly technologically savvy have been able to go in, set up their account, request their records. It's very user-friendly, and CareSync does all the rest of the work.
So what's the fee for using CareSync? Is it an annual subscription, or how does that work?
We approach it from a couple different routes. We offer a one-time health history package where $99 will go back. You can put an unlimited number of doctors over 60 days, and we'll go and get records and build out the health timeline, as we call it, for the user. But for our chronic patients, it often makes more sense to use the subscription, and we offer that for either $19 a month or $199 a year for those who like to pay it once and not think about it again.
That's great. So you have options. And how long does it take to carry out this process?
You can get started from account creation to having requested your first records in under 2 minutes.
That's great. And how long does it take you on average to compile all these medical records for a patient? I know that's a broad question, but it is
a little broad, but that's okay. Under HIPAA, they're required to provide access within 30 days. So we have systems in place where our people will reach out, and if they don't hear from a provider after a certain amount of time, they'll say, hey, we need to get these records. And so we get them in really within the 30 days. And then we scan the whole chart in first. Well, we do a quality check to make sure it is actually that patient's medical records. We scan the whole entire chart in. And then we also put in the information from each past visit. So they get queued up, but relatively quickly, and the user is notified the whole time. So it's marked as records requested, records received, and all that. So you know where you are in the process.
So you can follow the process along. So how many people are using CareSync now? How many have enrolled?
We have a few thousand people based on just kind of a national, not all that intense marketing campaign. So we're really just starting to roll out to the masses.
Well, that's great. So how do people find out more about what you do?
Well, we have a website, www.caresync.com. And we are also available on the Android, Google Play, and the iOS App Store.
And what is the app called? How do they?
CareSync.
Just CareSync.
CareSync, yep.
Yes, CareSync. So that's great. Yeah. Well, what few thoughts do you want to leave in the last couple of seconds here for our listeners?
Well, I just really want to emphasize that as patients and consumers of healthcare, I think it really is our responsibility to be equipped with our patient information and the complete record, and have access to it, know what it's in there, and find errors that we can then have corrected. It's just really important to be able to access and understand your health information.
Well, that's great. Well, thank you for joining us, Courtney. We really appreciate it. And Cindy, you as well. Thanks for bringing Courtney to us. This is Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.